Good evening and welcome to Have a Seat with Chris Hansen. You are now on the front lines in a battle against a predator called COVID-19, coronavirus. Tonight, once again, we're going to take you inside this battle. We've got a couple of different guests. Vincent LeVien, who's with the Emergency Management Task Force in New York City. He's been at the front lines and has some harrowing stories of the effort to try to supply our frontline defenders in this, the police, the firefighters, and the doctors in the medical center. We also have Dr. Maurizio Miglietta, who's going to join us tonight. He too is involved in the effort to save thousands and thousands of lives. We'll talk to Ed Troyer of the Pierce County, Washington Sheriff's Department, and we'll have Connor Hansen from Oklahoma City giving us a sense of what is going on in the heartland. I want to get to Vincent LeVien right away. Vinny, thanks for being on. Have a Seat with Chris Hansen. How are you tonight?
Good, Chris. How are you?
You got to be exhausted, buddy. Tough work.
Yeah, it's been a long past 3 weeks.
So let me just introduce you a little bit further. Vinny is with the Emergency Management Task Force. He has worked for years with government and law enforcement. He is the CEO and chairman of I Got a Guy, which is a networking consulting agency. He brings all this together with his knowledge of law enforcement and his experience in crisis management to try to help this situation tonight. Already, the Emergency Management Task Force has supplied first responders with some 30,000 masks. Tell me about that effort, Vinny.
Yeah, Chris, as you know, worked down at Ground Zero. Hurricane Sandy had some White House advance, and I do the government affairs for the Catholic Church, and we're the largest provider of social services in New York City. So, thankfully to the bishop and to the Catholic Church, they've given me the ability to help people. And I think a lot of people are aware that Catholic Church helps people every day on the front lines of being and living in New York City. We felt obligated that we had to act. So the Emergency Task Force was activated like it was activated after 9/11 and Hurricane Sandy. And we immediately went into action. We have a lot of relationships with the NYPD and the fire department, the mayor's office, the governor's office. We're the largest provider of social services in the country. Obviously, our churches and our Catholic schools, largest in New York City. And we immediately responded. And the first thing that we saw that the desperately needed is these N95 masks. Nobody had them. Police officers, the firefighters, the nurses, the doctors. And as you know, after 9/11, I'm a worker from 9/11 with the World Trade Center Health Service.
Absolutely, yeah.
Ironically, the World Trade Center Health Services is closed down, and all the rescue workers that are trying to get checked for a test for COVID-19, there's no designated place to go to get tested, which is completely, be honest with you, a disgrace. I've been calling everybody and saying, how do you not have a designated location for our rescue workers that risked their life 19 years ago, that Christine Todd Woodman said you don't need to have a mask on, that the air was healthy and clean, and thousands of my friends that I've known that I worked with died. So how the city of New York didn't have stockpiles of N95s is outrageous. So the bottom line is I have a lot of contacts, a lot of relationships, started calling people that I knew. The first one we got was 30,000 N95 masks, medical masks for the FDNY EMS.
So those 30,000 have been supplied already. Those you've been able to pass along.
Sunday, went to Hunts Point, opened up a warehouse. Contacted, ironically, somebody from the Chainsmokers. Big act, Alex and Drew called me through Sony Records and said we want to help, and they connected me with somebody else, and they said we have 30,000 masks we want to donate. So I obviously the front lines and the doctor that's on the call. I've been to these hospitals. I'm getting calls from my brother-in-law who's an anesthesiologist. They don't have these masks. But think about that. These doctors, these nurses, Chris, are going on the front lines. They're saving people's lives, and they don't have a mask to protect themselves.
So just to set the scene a little further, Vincent, you are in an area, New York City, that region where there are 60% of the new positive cases for COVID-19 are right there in the New York City area, and 1 in 1,000 residents have tested positive or are believed to be positive for coronavirus.
Yeah, I Chris, be honest with you, and I've been on the front line since day one. The test and the test availability to get tested, and the doctor knows this, wasn't until last week. When the coronavirus hit New York, it hit New Rochelle up in Westchester. I was on the phone call with the county executive, George Latimer. I've been up to Westchester for the site. I've been with the governor's office. I was with the governor's office today, literally right before we got here. You should know the governor forget about the politics, is doing an exceptional job. His leadership, his ability to lead in this crisis, I have to say, as watching him and seeing how he's led, I'm very proud of him. And forget about the politics. The mayor has been a complete disaster. And I have to say, the governor and what he's done, he set up his own testing sites. You go up to New Rochelle, that testing site, he worked with Mike Dowling for Northwell. He did it himself before the CDC came, before FEMA came. Now, it's important for you to know, Chris, before you say anything, these tests, and the doctor knows this, New Yorkers should have been tested weeks ago.
Absolutely.
Right? So what you're going to see right now, and I'm somebody that's seeing it on the ground. Now these test kits are going out. You're going to have thousands and thousands of people that are going to be tested out positive because these tests have not been able. These people have not been able to go testing. And so you're aware when you call this wonderful hotline, you have to, and the doctor knows this, you have to have 4 symptoms. And all those 4 symptoms, even if you have them, then you have to be able to be in contact with somebody from Italy or somebody that is a known person that was confirmed as a COVID-19 positive. So there's hundreds of thousands of people that have not been able to get tested. And
let's go back to the mask for a minute, Vinny, because I think this is important and people need to know about this because this gets to the, we have these great stories of people volunteering, the doctors, the first responders, guys like you, and these masks are in desperate need. You get a call, you become aware of a situation where a private equity company or somebody saying they're a private equity company says they have 35 million N95 masks in a warehouse near JFK.
Correct.
Who calls you?
So,
and what happens from that call?
I get a call from somebody that I've known for a very long time, and he calls me and says, I know somebody, and this person is a broker for a big company, and they have these masks. Okay, Sunday morning, I call the broker. Broker's very legitimate. I'm like, okay, I'll call the governor's office right now. I'll put you on phone with the governor's office. I need to know where the location is of the hangar. The governor's office, the director of emergency management, Mike Hopi, immediately responded. The PAPD, the Port Authority Police, immediately were on it. The governor's office went into action within 20 minutes of me reaching out to them. The Port Authority Police detective called me and said, Vin, give me the information. We want to vet them. We feel that they're real and accurate. Let's go find the hangar. Now,
this is a big development, 35 billion of these masks that are desperate.
Yeah, and obviously, as you know, the doctor knows this. There's none right now in New York City. I just left NYPD police officers, FD1 firefighters, New York State troopers, doctors, nurses. Nobody has them. And if they have them, they're trickling down because they're getting them from a family friend. So I then immediately, the governor's office, the director of emergency management, Mike Colby, called me and said, Vin, what do you think? I said, let's vet them. They vetted them. They had 2 different shell companies, 1 private equity company. We then said, okay, the private equity company, shell company, the pharmaceutical company looks real. They then wanted an IOI. They wanted a letter of intent on Sunday. The governor's office received that. We then said, okay, they wanted a PO, and I'm like, listen, people are dying. Let me just go and see the hangar. If the hangar has the mask, I can then go with the State Office of Emergency Manager, Port Authority Police, and we can go and see the mask and say, okay, the governor, FEMA, president, order and pay for these masks right now. They're at JFK. Time is of the essence. Let's get the National Guard trucks. With the director of the State Office of Emergency Management said, we'll bring down the trucks to JFK. We will load the mask up. We will get them to the people in need.
So it appears that this is not, do you think these guys were scamming you or do you think they were holding you up for money?
Well, on Monday, we're now on the phone calls with them.
Right.
The Governor's Office of Emergency Management, the PAPD, the police officers for the Port Authority, where supposedly this hangar has 35 million masks in one of their hangars on their property. They said, Vin, we're calling them now. We want them on a location. We're dealing with the broker, then with the CEO, then with the private equity company. And I'm like, okay, guys, you got your letter of intent. You're going to get the PO from the governor's office. The governor's staying in New York working with the president of the United States. If anybody's going to pay a bill right now, it's going to be them, right? FEMA's going to have billions of dollars. Show us where the hangar is. That was yesterday, right? Once we found out that they were not responding, I had an obligation to call the FBI. I contacted the Federal Bureau of Investigation in New York. As you know, the President of the United States yesterday put out an executive order that hoarding is now not only against the law, but if they find anybody hoarding masks in a warehouse, the FBI, by the Attorney General of the United States, has been instructed to literally go and take those masks, right? That was a presidential order from the President of the United States yesterday. This morning, thankfully, the FBI moved fast, and all three of those people, the two shell companies, the broker, and the private equity firm, the FBI responded immediately and started basically investigating them right now. It's an ongoing investigation.
Were there actual raids? I mean, the president talked about knocking on people's doors, the attorney general.
I don't know if they knocked. I think they knocked once, and then by presidential order, they went in immediately. All four of them, as you know, were immediately questioned. All I got as of an hour ago is an ongoing investigation, as the FBI will say, and they're going to report back shortly.
So it would seem that. Go ahead.
Think about this. There's a business in the United States of America on a private equity firm that supposedly bought these masks a month ago for $1. They're selling them for $6, and they won't give the governor, the Port Authority of Police, or the director of the Office of Emergency Management a visual inspection to see them while people are dying.
That is absolutely outrageous, Vinny.
It is. And I have to say, the FBI, Ed Sweeney from the Assistant Director of New York, he moved quickly. I contacted him at 7 a.m. They were knocking on these doors at 9 a.m., 10 a.m., and they knocked hard. So I can tell you, these individuals that got, their offices immediately were, cased with FBI agents. They started contacting me. I'm like, at this point, you still haven't given me the location of the hangar. Deal with the FBI and the governor and FEMA at this point, but I'm not going to communicate with them.
So in the best case scenario, these guys had the masks, but were trying to get the highest amount they could. In the worst case scenario, they were scamming and never had the masks in the first place.
Correct. Either way, the FBI and the Department of Justice is going to deal with them in a very swift and very direct way. Because as I have to say, as somebody that worked down at Ground Zero, these businesses, any business that's watching this, you're a disgrace. You're a disgrace to the United States of America. You're a disgrace to our economy. And you're a disgrace to people that are dying right now in New York. You should be ashamed of yourself, and you have blood on your hands.
These are the exact people that the Attorney General was talking about in yesterday's briefing, saying that, look, we're not talking about people hoarding toilet paper here. We're talking about companies who are trying to engage in price gouging. We're not going to stand for it, and we will come knocking on your door. And that's, in fact, what the FBI did in this very case involving these alleged N95 masks.
They came knocking first thing this morning.
Do we know if there are arrests? Do we know if there was anything confiscated? Do we know if those masks actually existed, Vinny?
I do not know. As you know, Chris, it's an ongoing investigation. And, I have to let the professionals in the FBI do their job. I do know, before this call, Mike Hopi from the Director of Emergency Management for the Governor's Office called me and said the PAPD in the state of New York still do not know where these masks are.
So we don't have them. How bad is the need on the front lines? You were with police officers today, firefighters today, with the governor's emergency task force, with his director of emergency services. Tell me, how bad is the need? I know they're ramping up the Javits Center for 1,000 beds. Tell me what's going on.
I worked down at Ground Zero for 6 months, right? We knew right then when FEMA came in and the Office of Emergency Management came in, how bad it was. But we responded immediately because obviously we knew what we were dealing with. I really think people that had no idea going into this. It's like a death of 1,000 cuts. Nobody knew what we were dealing with here. Nobody took it seriously, right? So now I can tell you, walking into these hospitals, seeing these doctors, seeing these nurses, they do not have the equipment to adequately do their job and save lives. And not just that, they're risking their lives every day. It would be like sending a soldier into war without a gun. My brother-in-law is an anesthesiologist. He is responding to a hospital. He called me 2 days ago and says, Vin, I have 3 kids. I don't have a mask. And I got in my car and drove out a box of masks for him and the attendings at his hospital.
This is how bad it's gotten.
I'm getting calls from every hospital in New York, NYU Langone, New York Cornell, you name it, Health and Hospital Corporation. Every single, and I'm sure the doctor's going to confirm the same thing. They don't have the equipment, and the procurement people in the hospital that is trying to get the equipment. They can't get it. They can't get the mask. They can't get the gowns. There's a splash guard that goes over the mask. And what they do have is so limited that they're sharing it. They're sharing the mask, going in to a triage, going into a person that is confirmed to have COVID-19, risking their life to save people's lives, and they do not have the equipment. And I can tell you, firefighters, NYPD, state police, doctors, nurses, I see it firsthand. Whatever you're hearing on the news, whatever politician is telling you, I could tell you they don't have it because I see it every day.
Vinny, I want you to stand by for a minute because I want to bring in Dr. Maurizio Miglietta, who's been on the front lines here in New Jersey, which is, essentially the same as New York in this battle. Doc, thanks for being with us again tonight. You heard what Vinny had to say about this protective equipment. How bad is it out there from a doctor's standpoint, and how critically needed are these masks, these protective gowns, these face shields, et cetera?
So obviously it's called protective equipment for a reason. It is truly protective. It is life-saving. And what a shame it would be if someone were to catch a disease because someone was hoarding it up or not making it available. We know that the masks themselves prevent the droplets from getting absorbed into the respiratory system. And quite frankly, masks also remind you to not touch your face constantly, and touching your eyes and your nose and your mouth can also infect you. So masks work very, very well. It's been proven. And without it, people are at risk.
Now, we heard from Vinny how bad it is on the outside in the streets. What's it like in the emergency rooms in New Jersey right now?
So at this point, we have adequate masks to get the job done. But I can tell you supplies are running short. And when you look at the curve of infections in the United States and deaths, our curve is like this. It is almost vertical compared to other countries. So this is not going anywhere anytime soon. Things are moving forward, and we need to keep up with the pace of the disease. And at this point, with the current supplies, we cannot keep up with the pace of the disease. Hospitals are being forced to make some big decisions. There's hospitals who have come up with strategies to keep the used masks, hold them for now, put them under sterilization techniques such as UV light, that in the event that we run out of masks, we may have to use masks that are already used.
How dangerous is that, Doc?
I mean, you hope that the sterilization techniques such as UV light or spraying with chemicals will do it, but it's really suboptimal, and there's not a lot of science behind it, quite frankly.
We heard the governor of New York talk about a new technology potentially because of the shortage of ventilators, which are going to be in severe demand very soon, actually splitting a ventilator between two patients. How is it looking with ventilators in the hospitals in your area?
This is coming to a crisis point very, very soon. As you know, the virus affects the respiratory tract. And in the severe cases, which thank God is a very small amount of patients, but then again, when you have a large number of infected, that small percentage becomes a big number. And that number is overwhelming the number of ventilators we have in each hospital. So there's been amazing communication between hospitals of sharing resources such as ventilators. There's been wonderful creative people online like anesthesiologists and respiratory therapists who are coming up with amazing ways to share one ventilator to 2, 4, or I even saw one story sharing amongst 6. But you have to understand, to fit that many patients in one regular hospital room is not that applicable. Obviously, if it's an open room, you could fit more patients, but this is all suboptimal. This is unnecessary. We knew this was coming for several weeks and months, and this should have been taken care of a long time ago.
What happened? Where was the breakdown, Doctor?
You know what? I don't think it's a great time to point fingers at different agencies or the government or anything like that. The fact is, we are here where we are today. We have an incredible country. We have incredible first first responders, doctors and nurses, and creative people, very smart scientists. And I think we're coming up with a lot of different efforts on how to combat this, whether it's through prevention, whether it's some of these new medications that are really showing a lot of promise in terms of combined medical therapy. Unfortunately, the disease is pretty severe. When you're sick, you are very sick. And when you're going on a ventilator, there's a very small chance you're coming off that ventilator at this point.
Are the ER rooms where you work in New Jersey, the ones that you see, the ones your colleagues see, are they currently overwhelmed? Are they getting to the breaking point, or are we already there?
We are not at the breaking point yet. I can tell you that I have concerns over the next week or two. You know, this is hitting in certain pockets. I can tell you I work at a few hospitals in the area, and one hospital is near the brink of becoming overwhelmed, and a hospital only a few miles away within a 5-mile radius is not that affected yet. I think we're getting to a point over the next week or two where our system's going to be taxed.
How long until we are putting doctors in the position of having to say, okay, we've got a 90-some-year-old person not in great health on a ventilator. Do we take that person off and risk their life to save somebody who's very ill, who may be younger and more viable? That's a terrible decision to have to make. Are we getting close to doctors having to make that decision?
So, you know, you hear these heartbreaking stories in other countries of the decisions that doctors and administrators have to make, whether someone lives or dies. And as a doctor and as doctors and nurses, we take that oath to always protect life and do everything we can to preserve life. So it's really heart-wrenching for those of us who have to make those decisions, and we don't take it lightly. Obviously, from a society standpoint, decisions tend to be made that when someone is in the later stage of their life with lots of medical problems, poor quality of life, low life expectancy, that we will tend to favor treating someone who has an opportunity to heal and come out of this with greater potential. You heard this story of a priest in Italy who gave up his ventilator to save a yet very young person, and that young person ended up dying as well. So they both died. So none of it's a great scenario, but it's really it's a tough decision, and no one wants to make that decision, but we're going to have to in the near future.
60% of the new cases are in New York, New Jersey, Connecticut, that area. 1 in 1,000 people already infected. That is staggering. Have you ever seen anything like that in your 50-some years, Doctor?
No, I haven't. I never thought I'd be in this situation and see the entire country affected by it and the world affected by it like it has. I mean, honestly, this is something that you watch on TV. When you look on TV, you see the shows that people are watching, like Contagion or World War Z. You know, this is our version of that. You know, for the far majority, the illness will be self-limited and we will get over it. Thank God for that. But for a subset of patients, this is devastating and it will kill you. You know, in other countries, it's been the elderly with comorbidities, meaning that they had medical problems.
Right.
Unfortunately, in our area, we're seeing young people in their 30s, 40s, and 50s with really no risk factors who are ending up on ventilators fighting for their lives.
Vinny, you know government, you know law enforcement, you know the ways of getting things done as a consultant, a management guy. What's it going to take to get everybody like the doctor, like the fine people at NYPD and FDNY, what they need to do their jobs?
I have to say, and you're looking at what people did after World War II, how the public-private partnerships came together, and how Ford stopped making cars and built, you know, Army personnel. I really think that the American businesses need to step in and step up. I've seen a lot of them already do it. Anheuser-Busch is making sanitizer. I think this is not just a government issue. I think the private sector, all these businesses and all these people now are working from home, all these businesses that have thousands and thousands of people that are going to be either laid off or not have a job. Let's put them to work. And this is people. The doctor realizes this because he's on the front lines. This is a war. This is a war like we fought in World War II or in Vietnam, and you got to attack this like a war. And what I've seen on being on the front lines with these heroes, the doctors and the nurses are on the front lines here, and they should have all the available resources that the United States can offer them, not just from the government. You can say it's FEMA's problem or the president's problem or the governor's problem. Let's put politics aside and let's save lives. This is very simple. We have a lot of corporations. We have brilliant people in this country that have done amazing things. Let's get them all together. Let's get them all in a room, shut down the automotive, shut down the airplanes, and let's start building critical equipment that the doctors and the nurses need to save lives. That's it.
Doctor, what happens when the doctors and nurses started getting sick?
That's it.
Well, it's happening. I mean, I know personally of several doctors and nurses that are either in the hospital or are now forced to be in self-quarantine at home. It's a scary time when the people there to help you can't. So it's going to get to a point, you know, there's been a lot of requests from state and federal agencies asking for doctors that don't necessarily work on the front lines, that aren't intensivists or medical doctors or nurses, that let's say are psychiatrists or OBGYN or other type of specialists to come in and help out, because people are starting to get exhausted and people are starting to get sick, and we're going to need the backups.
You know, Vinny brings up a good point about industry and technology. And one of the things we talked about with you last week, Doctor, is a technology for disbursement of chemicals that can kill this virus on contact and prevent it from coming back. You know, there's word about these cruise ships now where the virus can live on surfaces in these cruise ships for up to 17 days. We're talking about this nano biotechnology that we spoke of last week. It was actually put into action today at a hospital in New Jersey. Tell me about that.
So Hudson Regional Hospital in Secaucus today was the first hospital in the United States sprayed with this Protex molecule that's been around for a long time, FDA approved, EPA. It was invented by Dow Pharmaceuticals a long time ago, but now we realized it has a use in not only disinfecting whatever surface it's sprayed on, but also preventing infection for weeks and months. And, you know, people say, where's the science? Where's all that? We know it kills things. We are optimistic that it is going to do as our basic studies have shown it's going to do. This is potentially life-saving. And at this point, just like Vinny was saying, it's all hands on deck. Whatever tools you have in your drawer to help combat this and to save lives, you take out. Whether it's trying experimental drugs, whether it's using these disinfectant chemicals that are non-toxic to humans. I say you throw all guns at this, and because we're in a fight of our lives now.
So today, this technology was used in this hospital, as well as some emergency cars, ambulances, EMS cars, and police cars.
Yeah, so today it was sprayed up local police cars in New Jersey, ambulances, hospitals, surgery centers. We're hoping to do it in schools, churches, government buildings, so that we can get the first workforce back there. The problem with just disinfecting, as you know, is that when you disinfect a surface, if someone comes by 5 minutes later or whatever time frame and sneezes or touches that door handle, you've infected that area once again. So you need something that's long lasting and protective. And that's where this nanotechnology is really promising. And, you know, we're looking for the CDC and NIH to partner with us so that we can prove that this technology works just like our studies are showing it works.
And Doc, what do you think so far about this combination of antibiotics used the azithromycin as well as the hydrochlorone, the two mixed together. They're starting to do this, I guess, in New York. The governor has gotten on board there. The president's been talking about it as a potential game changer. With your background in medicine, what do you see there? I guess the thing that sticks out to me is that these medicines are used in some cases for malaria, and that there's been some evidence in Africa and other places where people take this as either prophylaxis or to treat malaria. There has been a lower incidence of COVID-19. What do you think?
So, you look at some of the studies and you look at the graph of each of these drugs used by themselves, and it's not impressive. It's very, very interesting phenomena. So you look at the antibiotic alone, and the curve of effect is very flat. And you look at the antimalarial drug, and you see some effect of the drug. But when combined, the effect is very, very dramatic, and you reduce the viral load in just a matter of days. So it's quite impressive and quite promising.
Very good. Can you guys stand by for a minute? I want to take our viewers and everybody else to the other side of the country here. Stand by with us because I want to go and I want to talk to Ed Troyer, who's with the Pierce County, Washington Sheriff's Department. Ed, are you with us tonight?
Here.
Hey, there he is.
We're not allowed to have barbers right now. We can't go there, so we're all looking a little messy.
Yeah, I should remind everybody that we know Ed from the Pierce County Sheriff's Department because that's the law enforcement agency or one of the law enforcement agencies involved in one of our investigations that we do on our Wednesday night show, that into Gregory Jackson, aka Onision. But tonight we go to Washington State and Ed Troyer because you really are at ground zero here in this country. It's Washington State where the first case was reported after a resident there came back from the Wuhan province of China and was the first positive tested case there in Washington State near Seattle. Ed, what's the situation on the ground there tonight?
Well, yesterday the governor put an order out to stay home, stay healthy, and pretty much telling everybody to stay home and only essential people were going to go to work and shut everything down. At this point, the schools are closed for 6 weeks, which pretty much is going to bring us clear till next September. Graduations, just like around the rest of the country, are all shut down and the roads are pretty deserted. And right now we're building camps and we're looking for isolation centers because the numbers just keep going up as far as the positive tests are coming back. And that's because we're doing a pretty good job of testing. Over the last 3 days and tomorrow, they'll have tested pretty much every first responder, healthcare worker, and daycare worker in our county, which is Pierce County. We're just under 1 million, and we're south of Seattle, which is King County. So we're a smaller county, but we have the same big problems as everybody else has. And listening to your other guests, we're in the same situation where we don't have masks. Our first responders are not. We just don't have the PPE that we need because we're trying to divert it all to the medical centers, the doctors, the hospitals where we know people have tested positive, and we need to make sure our healthcare workers stay healthy and safe to take care of the people, and first responders are aware of that. So we're coming up with some creative ideas on our own. We're following guidelines. In the last couple days since the school's been shut, some of our deputies have given over 5,000 meals away to kids for lunch. We want to make sure they stay fed. We've done some really unique things where if a kid comes with their parents, we give them 3 days worth of food so they don't got to come every day and they can stay home and stay isolated. We figure whatever we give them will last 3 days, and perishables and non-perishables. So we're working on that and we're getting through it, and everybody's really working together, including our citizens and our faith-based groups and everybody else that knows they have a bit of this that they need to get involved and help, or we're not going to get out of it.
Ed, we spoke a couple of weeks ago, and really I thought it was about as bad as it was going to get, and was alarmed at your figures, which you shared about how many first responders you had, both sheriff's deputies, people on the fire department and the EMS guys who were being quarantined because of potential exposure. Did you ever think this would become so severe?
Well, the warnings were out there, and fortunately, we have Mount Rainier is in our county. So our county and our Department of Emergency Management and our Urban Search and Rescue Task Force have spent years planning for disasters, whether it be floods, earthquakes, whether because we're right on a fault line. So we got the people together. We've worked really, really well on all these other disasters through drilling, but we've just switched over to this. But this has never happened before. And so as a doctor and your other guests can tell you, we're learning hour by hour the ramifications, what happens on the back end, and what do we need to fix really quick. And we're doing it. We're keeping up with it. We've downgraded our populations in our correctional facilities for the people that don't need to be there, because the last thing we want is to introduce that virus into a correctional facility. And so far in our correctional facility, which holds right around 1,200 people if need be, we've drawn the population down to 800, and we have not had a positive case or anybody test positive in our facility, because we check them before they come in. We check them before they move them. If they show any signs, we have a procedure to get them out, get them tested. And I think we're doing a great job out here. It's just, we just don't know where it's going to go. And the first responders are obviously the ones on the front line, and the medical people are the ones that are going to determine what we do next. We take our guidance from the health department, Tacoma Pierce County Health Department, and they're working with the medical people, and we've got our trust in them that they're going to give us the best ways to stay safe and what we need to do to keep the public safe. And so far, we've been pretty lucky that the public is working with us and being very cooperative. And that's pretty good when you're talking 1 million people.
Give me a sense of the scope now. Is it getting better in your part of Washington State? Is it stabilized? Have we seen the curve flatten at all?
Well, what we don't know is the answer to that, because we're testing so many more people. We've got a good procedure for testing first responders, and as the more tests become available, and as we test, the number is going to automatically go up. But what we need to do now is watch the days and see if the percentages are going down compared to how many people are being tested. And that'll give us an indication of what we're doing, whether it's working or not. And our governor is pretty much, as we yesterday said, stay home, stay healthy. That's what we're using out here as a slogan. And it is pretty much a shelter in place, and non-essential people aren't moving around. It's pretty eerie to see every bar, every restaurant, every church, every entertainment center, you name it, where people gather, are closed, and the traffic is dropped by about 85%. So most people are listening to the warnings and get that it's serious out here. We're not having the issues nearly as bad as we see the people on the Gulf and people partying in Florida and gathering and doing all that. Our young people are getting the message, and it might be because we were first and had some of the first death in our nursing homes and our retirement centers. Some of them got hit pretty hard. We have some that have had 10 to 15 people die in one facility, and they're getting that under control. And I think just a lot of kids and a lot of the people that were out here saw how serious it was right up front, where it looks like other people in other areas aren't taking it seriously, and that's gonna make this last a lot longer.
Ed Troyer, thank you very much. Stand by with us for a minute. I want to go to one other guest now before he's got to go back to work. Our next guest is Connor Hansen, and if that sounds and looks familiar, there's a good reason for that. He not only is a news reporter for Fox 25 in Oklahoma City, he is my son. Connor, thanks for being on the show tonight. How's it going?
Good. Finally get the invite.
Exactly. How Connor's right downtown Oklahoma City. There have been a number of cases in Oklahoma City. Give me a sense for what's going on there. How bad is it? It sounds like they've just about shut everything down, although you were saying the other night that some of the suburbs still had restaurants and other establishments open.
Yeah, clearly not as extreme as the coast like Washington State or New York, New Jersey, but to put it in perspective, we have 109 confirmed cases here and 3 deaths, but our governor, Kevin Stitt, acknowledged today there could be more like 500 or more positive cases. That's because we've just had such a shortage of tests. Last week, he announced we had less than 100 tests, so you can imagine how quickly those went. And, hopefully, I know officials are hoping we can take advantage of the fact that we can watch the cities like New York or Seattle and see how that goes and really prepare for it. Biggest change actually came up today. Starting at midnight, the governor has banned all groups of 10 or more people meeting together. He's had a lot of pressure up until this week to make a statewide declaration, a statewide rule for how things should operate. But he went ahead and said all 19 counties where they've had confirmed cases, those will close all non-essential businesses like your bars, your spas, hair salons, things like that. So starting to see a lot of changes here. So far in Oklahoma City, they shut those down a few days ago. So it's been pretty quiet. A lot of us are working from home. I'm working from home right now.
100 test kits available in the entire state of Oklahoma.
Well, that was last week. So probably less unless they've gotten more. The governor's team announced today they're anticipating having another 10,000 tests by the end of the week. Then they hope they can test up to 2,000 people per day. But, everyone's really waiting to see where those testing sites are going to be and how that's going to work. Obviously, still people like healthcare workers or people that really have those critical cases are going to be the ones to get tested first. But we've heard already from a couple of people the past few days who have been trying to go get tested. I know in one case specifically, a woman we talked to on Friday tried to bring her 5-year-old who was exposed to a positive case in her preschool. She has asthma. Her and her mother both denied tests. So just to give you an idea of how short they really were, and that was last Friday.
That was an interesting story. And the other one that you did that interested me, Connor, was the interview with your attorney general there in Oklahoma talking about scams. And I hate to even bring this up, but you heard what Vincent LeVien in New York City was talking about with this attempt to sell or scam at least the state of New York with an offer of 35 million N95 masks. Are we seeing this in the heartland too? Are people trying to take advantage of this tragic situation?
Haven't heard anything like that so far in Oklahoma. It was interesting today, the governor's team saying on average, the hospitals probably have about a 9-day supply of those PPEs you were talking about earlier, the personal protection equipment, like masks and gowns. Luckily, so far, I haven't seen any type of scams like that. The Attorney General last week giving a pretty stern warning. Once they declared a state of emergency federally, it became illegal to certain price gouging, marking things up 10%, and they're hopefully watching that very closely to make sure that's not going on. They have a whole team dedicated to that. So you hope it doesn't happen, but you never know for sure. We're a few weeks, it seems, behind some places in terms of cases getting here to Oklahoma.
All right. As a journalist, I've asked all my questions. As a father, do you have enough food in your fridge to last you the next week?
Yeah, for the next week about. Eating a little bit more, working from home. It is weird being a reporter and working from home. The set you're looking at is pretty much where I've been doing my live reports from. I've moved my entire desktop computer to my apartment, and we're all doing our best with the social distancing, and hopefully we're getting a jump on it here in Oklahoma before we get a lot more cases. Like the governor said, we could be in the thousands by the end of this, case-wise.
All right, Connor Hansen, my son, you take care of yourself. Thanks for being on the show, and I will check in with you a little later. As we button up tonight, I want to go back to Vincent LeVien one more time. Vinny, you there?
Yes, sir.
So what do you say now? Have you been by Javits Center or any of those places down there? Are they getting set up? I saw some video in there earlier today where they had, the beds in, they had some equipment in. They're going to use it as a hospital for 1,000 people, as well as a distribution point for hospital equipment. What needs to be done? Where is the need most urgent?
I was at the Javits Center yesterday. I have to say the Army Corps of Engineers, FEMA, is moving fast. They dropped in hundreds of troops, and they immediately start to basically retrofit. As a New Yorker, to imagine this, there's normally the auto show normally always comes in Easter time, and they are building thousands of beds to anticipating the people that are going to be needing this now pop-up hospital at a convention center that is known for huge conventions. Just think about that, Chris. They're setting up right now thousands of beds in a convention center in the middle and the heart of New York City. It's something that is, I have to say, as a New Yorker, surreal. Driving around New York City, the streets are empty. And to see the medical services, they're sending out emails and text messages. Basically, any doctor, any nurse that's retired, that's active, that wants to help, pleading with them because they're going to need thousands of doctors and nurses to help with these vital issues. Our hospitals right now, as you know, Chris, sorry about that.
Not a problem. That's live TV, Vinny. Go ahead.
Our hospitals right now, Chris, as you know, are already, and I see it firsthand, they're already busting at the seams. And the Javits Center is one, as you know, the U.S. Comfort is coming in right now, a huge military boat that's going to be stationed right near the Intrepid. They're bringing major institutional infrastructure right now into New York City. The intelligence that I'm getting, and I'm dealing with a lot of people, is they don't think that's enough. They think that Madison Square Garden and the Barclays Center and out in the Nassau Coliseum, as you go out even more east, if you look at even in Suffolk County at Stony Brook and Southampton, a lot of New Yorkers, as you know, left Midtown and went out to the Hamptons where they have secondary homes. They are now busting at the seams. Their military tents, a tent that you would see in Iraq, Afghanistan, and Syria, is now set up in the parking lot at the Southampton Hospital. Stony Brook Hospital, you're going to see these major military infrastructure from the Army Corps of Engineers having to set up hospitals like they do in Iraq, Afghanistan, and Syria, in the heart of New York City. They've already planned it right now, and the mayor and the governor have said, our parks, New York City parks, like Central Park, they're saying don't play sports, right? You can jog, but don't think you're going to do anything else, because they're looking at if they have to use our New York City parks as makeshift hospitals. That's how desperate they are in need of right now. And anybody's watching here, like any other rescue, like 9/11, I was blessed to see people from all over the world, all over the United States, come in to New York, firefighters, police officers, and help of what was going on there, because they knew that that meant something to them. They knew that they needed the resources. New York City needs your help. New York State, the governor, again, has done an extraordinary job and shown real leadership here. But New York City needs their help. And anybody that has if you have any medical background, EMT, EMS, if you can come into New York City, we could use your help, because these vital resources like the Javits Center, Chris, that I'm sure you and I have been 1,000 times to see wonderful things, is going to be used as a makeshift hospital to service thousands of people. Think about that.
Well, I guess that's the other question. And Dr. Miglietta, I'd like to bring you in on this too. It's great to set up the Javits Center. It's great to have the Navy boats come in and have an additional 1,000 beds there and at Javits. But we also need the doctors and the medical staff to make these things work. What do you need as a physician from a guy like Vinny LeVien and his effort to do your job? What's the priority as we speak right now here live tonight?
So I think the pressing priority is PPE as respiratory therapists. I think ventilators over the next few days are going to be of paramount importance. Listen, we watched this go through various countries throughout the world, and now it's our turn. It's hard for me to believe that we're not following the learned lessons of other countries. There have been countries that have been able to flatten that curve, as we say, that have been able to mitigate the virus and mitigate the number of infected and deaths. And, we're the greatest country in the world. I don't understand why we are not reacting in the same way that I know we're capable of in terms of the speed and efficiency based on lessons learned from other countries.
What should we be doing, Doc? What should we be doing that we're not doing right now?
We're starting to do it. These quarantine camps, the isolation. Quite frankly, I'm a proponent of lockdown the whole country. We need to start limiting social contact to the utmost extent. Social distancing, the concept is great, but, walking around to the supermarket, doing what I need to do when I'm not at work, it's not as strong as it should be. We need to limit movement. I know it's going to affect the economy. I know people are going to lose jobs over it, but it's the alternative is that this is going to linger on for weeks and months, and that people are going to get infected and die. We haven't even started thinking about the second wave that we're hearing about. People who think they're immune because they've gotten a minor version of it, getting infected for a second time and being far worse. We haven't even started thinking about those scenarios that other countries may be experiencing right now.
And I guess that's the question. We don't know yet whether you can get this a second time, or if it could be worse if you do get it a second time. What's the latest on that? What's the latest intelligence on that?
There's a lot of unknowns, obviously. I am by far an infectious disease expert. I'm a critical care expert. But there are case reports coming from overseas of people getting it a second time who had a mild case, who had proven corona, who are seemingly getting infected a second time, whether it's a different strain of the virus or the immunity is not long lasting and they get it again after a few weeks is unclear, but it's something that we're going to have to watch very, very carefully.
Do you see the flattening of the curve in sight, Doc?
Based on the numbers that I've seen, the trajectory compared to other countries, again, if you look at our graph, it is still quite vertical. We are not there yet. I'll let you know when I think it's flattening based on the numbers we're seeing. But when you hear of doubling every 3 days, 4 days, this is not going anywhere yet.
Dr. Maurizio Miglietta, final thoughts tonight.
I'm a true optimist. I know we will all get through this. It's going to be a hard time for all of us, personally, professionally. Again, all hands on deck. Everyone do their part. We will get through this. We will lose some loved ones. We're going to learn a lot from this for future episodes and infections. But let's pull out all the guns. It's no time to be complacent.
Thanks, Doc, very much. I appreciate it. We will stay in touch. Stay safe, stay healthy, and we'll see you soon. Vincent LeVien, final thoughts tonight. What are you thinking? What do you need? What has to be done in New York City and the Eastern region?
I think right now, I think FEMA and the president and the governor working together. Finally, good to see that the politics is set aside and two New Yorkers are working together as a team. I think really, and as you know, the politics is toxic on both sides of the party now. Everybody needs to work together as Americans and just get the job done. And there's a lot of people that have a lot of talented backgrounds in logistics and getting things done. I think those people could be a vital asset to helping people right now in New York City and in other parts of the country. One of the biggest issues right now is the logistics are so massive, are so big, and are so great that there's so many needs and so much, and the doctor knows this. All these hospitals are calling for the same items. Everybody is requesting the same assistance at the same time. And think about this. You get a hurricane, FEMA comes down, disaster relief, like they did in Hurricane Sandy, and they have an isolated area like New York City that they can have a command and control. This is throughout the United States. New York City, LA, Seattle, Chicago, and it's getting worse. So I think my best advice is if you have experience in logistics, you have experience of how to get things done, come to New York, and I'll be sure we can put you to work and you can help us.
Vincent LeVien, of all the people I know, and I know a lot of resourceful people, I trust you to help get things done. Thanks for being with us tonight. I appreciate it. Ed Troyer from Pierce County, Washington. Final thoughts from you tonight.
Well, I think one of the things that we need to do is take advantage of all our resources. I actually have this mask here that was made by a knitting group, and some ladies put it together with the blue line on it and everything. So everybody can do their part, because we know we're giving the medical gear and the 95 masks to the hospitals and the health workers, which they do need them. But we don't want to leave our people vulnerable. So somebody came up with an idea, and they're making them triple material. They're washable. They're better than nothing. They're not 95s, but it's better than not having anything when we're around kids or around the vulnerable population, or we're going to domestic violence. What people don't understand is that even though this is happening, crime is not taking a break, and that's across the country. Officers are still getting killed in the line of duty. We had one in our state today get killed in the line of duty. We still have people doing robberies. And if everybody's home, you know what that means? That means, yeah, burglaries might be going down because people are home, but commercial burglaries are going to go up because nobody's at the businesses. So we're still responding to that. And people being stuck in houses together, domestic violence is going up. So as law enforcement officers, we got to continue to do our job, continue to work, continue to be safe, to keep others safe. And we really appreciate the medical field and the health departments across the country that are learning and sharing information. And then it trickles down to us to make sure that we're safe. And if everybody can do their part, no matter how little it is, even if it just means stay home, the sooner we'll get out of this.
You know, Ed, it's interesting. You got it first. New York City got it later. What advice do you have on the West Coast there in Washington State for the East Coast?
Well, we're pretty lucky in that we're rural and we're not as tight as New York City. And what that shows, if people are not around each other as much, the numbers go down. And even though we're more rural, we have a big city in Seattle. Obviously, they have the most numbers. And then, of course, you go to the second population, they have the most numbers. And third is third. That'd be us. But even by percentage, they actually have more because of the denser population. So I think what the lesson to be learned there is, if you stay away from people, obey the 6 to 10 foot rule, don't gather, stay home like you're supposed to, so you can't spread it or catch it and then spread it to other people, the sooner we're going to get out of this.
Ed Troyer, Pierce County Sheriff's Department, thank you. Stay safe, stay healthy. We'll keep in touch with you along the way and talk to you very soon. I appreciate it. I want to thank everybody who is on the show tonight. What an amazing group. Vincent LeVien, Emergency Management Task Force in New York City, IGG. Dr. Maurizio Miglietta on the front lines, Connor Hansen, Ed Troyer. Thank you all. And before I go tonight, I want you to consider one thing. It's a bit of a personal story. The vast majority of people being infected, as you probably know by now, are between the ages of 18 and 48. And if you think you're immune, if you're a young person and don't think you can either get this or don't think you can get sick or die from it, listen to this. A good friend of mine, whose significant other's nephew was in Florida, Miami, Florida, 21 years old, college student, was on vacation, not feeling so well. Mom urged him to come back early, went to the doctor, was given some medication, suspected coronavirus, was going to wait it out, be in quarantine at home, woke up the other morning feeling disoriented, called 911 and died on the way to the hospital at 21 years old, suspected coronavirus death. So think about that. I don't want to end on a down note because I think there's a lot of things to be positive for in all this. I think we see people banding together in New York City, in Washington State, in California. I think we've got some very, very smart people from the scientific community working on this, dedicated on the front lines. I'm going to try and do my part and let you know what's going on as best as I can from where I can report. But again, let's follow all the basic rules. You know them by heart by now. So stay healthy, stay well. I'll see you tomorrow night on a different topic. We'll be back taking a look at the Davi Vanity investigation, as well as the investigation into Onision. And we will have an exclusive one-on-one interview with the person known as Jesse Slaughter. It should be very compelling. And if there are any updates as well on the COVID-19 coronavirus, we'll bring them to you as well tomorrow night, 8 Eastern. The next time you can have a seat with Chris Hansen. Thanks. Be safe. Be healthy. Have a good night.
You bet. Hope you've had a good Tuesday.